Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
Welcome to the Concussion Corner podcast. I'm your host, Dr. Jessica Schwartz, and I'm thrilled to be joined back with Dr. Tad Seifert this evening. Dr. Seifert currently serves as the director of Norton's Healthcare Sport Neurology program in Louisville, Kentucky. He is an independent neurotrauma consultant for the NFL, serves as head of the NCAA Headache Task Force, and is chairman of the Kentucky Boxing and Wrestling Commission's Medical Advisory Panel. His research interests include post-traumatic headache in athletes, as well as combat sports medicine. Dr. Seifert is a graduate of the University of Oklahoma College of Medicine in Oklahoma City. He completed his residency in neurology at the University of Texas, Houston, and did a subsequent fellowship in headache and facial pain at the renowned Houston Headache Clinic. He presently serves as a team neurologist for a number of Kentucky and Indiana-based colleges and universities. Tad, welcome back to Concussion Corner.
Thanks, Jessica. It's good to be back.
Good to be back. A little warmer these days, so I'm happy to have you back in a better climate for all.
Absolutely.
So we're just going to kind of hop right into this, and I kind of want to build you up a little bit here, and just, most folks don't know and aren't aware of, the world's first prospective study in concussion via the NCAA and Department of Defense. Obviously starting in 2014, for those who aren't in the know. We kind of kicked this off, at the White House, and it's kind of trajectory down, into data collection 101 throughout NCAA Division I to Division III programs throughout the United States. I was wondering if you could discuss your role as head of the NCAA Headache Task Force and why this is such an important component for concussion research.
Yeah, for sure. About 2014, Dr. Brian Hainline and I had just some sidebar discussions about headache within the collegiate athlete. Headache is really how I got into the concussion space initially. And that's really how I got interested in the field and how my practice has evolved into kind of a hybrid of sports concussion as well as still some primary headache medicine. But as we continued to discuss the topic, we realized that nobody's really ever taken a hard and fast, dedicated look at headache within the collegiate athlete population, at least not in a very structured way. So that was really where the seed was planted and where the NCAA Headache Task Force began. And I was lucky enough to be asked to head the project. So I incorporated a number of disciplines, athletic trainers, neuropsychologists, primary care sports medicine physicians, neurologists. And essentially what we did with phase one was we looked retrospectively via cross-sectional survey at the prevalence of different headache types within the competitive collegiate athlete. And we had over 800 subjects, so we felt like this was a good comprehensive representation of the collegiate athlete population. It involved males and females, it involved contact and non-contact sports, and that was published in 2017 in the journal Headache. Now, where we are currently is getting ready to kick off phase two, which will be a portion of the CARE consortium looking prospectively at headache prevalence and incidence and headache types. Again, but this will be a prospective look. So we hope to be able to answer some more specific questions like relationship between head trauma and the subsequent evolution of headache. What comes first, the headache or the concussion? Are individuals with pre-existing headache disorders truly at higher risk for concussion like we suspect they are? Are individuals with a pre-existing history of migraine at higher risk for a prolonged recovery like we think they are? So the prospective study is really just going to help to clarify a number of issues, and I'm thrilled and honored to continue to be a part of it.
Yeah, and I have to say we're so lucky to have you doing that. So, I don't think our athletes and our future generations realize the importance of this work. So again, I sincerely say thank you from a level of gratitude.
No, thanks.
You talked about in our first podcast together, Tad. You talked about, and I just I'm going to surprise you on this a little bit. I didn't prep you for this, but you talked about that you were using some EEG in your practice, and we know that essentially a concussion is kind of like throwing salt water on an electrical circuit, right? So it's this
Right.
neurometabolic cascade that just kind of shorts things out. Things don't move as quickly, and we know that EEG or electroencephalogram essentially, it's a test that detects electrical activity in the brain. So I was wondering, hey, what are you using this for, and what are you finding? Is this all this preliminary, research data, taking in, or what are you finding with EEG?
This is all very, very preliminary, and it's a type of EEG called a QEEG, but really it's even more of a subset of that called evoked related potentials or evoked response potentials. And I'm working with a company that's based here where I live in Louisville called Neuronetrics, and we're doing some very preliminary work in high-level combat sport athletes, specifically high-level mixed martial artists. And there are certain measures within evoked response potentials or event-related potentials where when an individual is given an external stimulus, be it visual or auditory, you expect to see a certain quickness of response within the brain. I'm really trying to bring this down to the layperson level. It's tough to explain in a 5-second clip, but what we're seeing in what we're seeing in high level athletes is we're seeing responses that are much more robust than what you would expect to see. So higher level responses in the high level athlete, even when compared to age related cohorts that aren't high level athletes. And then what we're also seeing is after this individual, has a hard fight in the cage or the ring, those measures go down and go down significantly. So we're excited because we think that this is just another potential tool in the toolbox on helping to measure recovery after head injury, and another case of prediction of performance within the.
Interesting. You cut out there a little bit at the end. You're talking about measuring a performance at the end there, Tad?
Yeah, we think that it's also potentially not only a measure of recovery, but even potentially a measure of performance within the high level competitive sports world. So we're excited on a couple of different fronts there.
That's awesome. And just to our listeners too, just remember that a lot of the folks that are on this podcast of Concussion Corner, they're doing the big research or doing the big data. And we have to remember that, this is a rehabilitative injury, so we need to make sure we're accessing care that folks can access today and not, research 10 and 20 years down the road. But, hearing all this stuff is just exciting because we don't have any neuroimaging, we don't have any imaging that can essentially diagnose a concussion. And we know that concussion is a clinical diagnosis only, but it's definitely exciting to kind of see folks like Dr. Seifert, doing this research and trying to make a better world for our athletes tomorrow.
And and another reason why I'm really excited about the event-related potentials is because obviously within sports neurology, a big part of our practice is sport concussion. I mean, that's fairly cut and dry. That's a significant portion of every part of my day. But what a lot of individuals don't realize is that as sports neurologists, another part of our practice really is the practice of optimal sport performance from a neurologic standpoint. And it's not just myself. I know that in a number of areas within the United States and internationally, there are scientists that are trying to look at certain measures of performance and specifically prediction of neurologic performance within sport. So it's a proactive measure very different in some regards to a reactive treatment measure like you see after injury has occurred.
Indeed, and I think from a physical therapist standpoint, from my lens, we kind of have seen that with ACL. And quite frankly, I've kind of taken a shift. Everyone kind of knows I kind of stick with the positive language front, that I've been reading some of my work for the last few years. But essentially, I'm like, why are we calling all of this like a prehabilitation, alluding that the athlete's going to get injured? Why aren't we calling this performance enhancement? So
Right.
so it's nice to see that this is working on many sides of the fence, or the aisle, I should say. Tad, obviously you're working with the entire NCAA, but why combat sports? What kind of led you into this paradigm shift with focusing on a specific type of athlete?
Oh gosh, a number of reasons. Probably first and foremost, I've just always been a fan of combat sports growing up. I mean, I can remember sitting on the couch with my dad watching Muhammad Ali in the latter stages of his career. So I've always been a fan in some regard. And back probably about 2013, I was approached by the Kentucky Boxing and Wrestling Commission to become involved just here on a local statewide level, and I was happy to do that. And it was quickly thereafter that I found that for sports medicine clinicians that want to see head trauma in vivo, right directly in front of their eyes, there's really no better wet lab than the cage or the ring, where I have a sport right here in front of me, and I have two competitors right here in front of me, where their goal is to inflict head trauma on their opponent. Mm-hmm. So, whether you agree or disagree with the sport, in my opinion, is irrelevant. But I think it would be remiss for us as sports medicine clinicians to not become involved in this genre of sport, to where we can proactively, again, help performance, help recovery after head injury has occurred, study head injury, and just be an active participant in that evolution.
Right. And, I was reading over your paper, and, we know that, about half, and on multiple white papers, about half of all fights in boxing, karate, and taekwondo actually result in an injury, with a significant number of these, injuries being head and neck, trauma. What are you finding in terms of maybe either legal law legislation and just fighters just wanting to get back into the ring to fight, obviously for fiscal reasons? What are you finding are some challenges as a ringside doc in that area?
There are still a number of challenges. Can you hear me okay? You're breaking up a little bit.
Yep, I got you.
There are a number of challenges still, across the spectrum of combat sports. One is the challenge of athletes that are trying to return to fight too quickly. Mm-hmm. And that's why we have fairly stringent medical suspensions from state to state commissions. They vary somewhat, but again, medical suspensions are in place to protect the athlete, and we hope that those medical suspensions are upheld. Sometimes they're not, which is another frustrating topic. The challenge of significant weight cutting. Weight cutting is probably the number one challenge in combat sports present day, because we have athletes, internationally as well as here within the United States, that are being hospitalized, coming close to death from acute dehydration, complete system failure, and even some reported deaths from aggressive weight cutting. And then there's also the challenge of performance-enhancing drugs. There's been a significant uptick within the UFC, for example, following USADA guidelines for drug testing. But performance-enhancing drugs are still a very real challenge and part of the sport.
What are you seeing, if you can take the listener to, kind of through, what is the weight cutting, what does it look like? When do the fighters get weighed in? And then maybe you can give a little history, to the concussion symptom overlay with like dehydration. which is why, a comprehensive targeted physical exam is so important with these
Right.
athletes.
Yeah. And, if you really want to see what weight cutting looks like and the ugliness behind that, I would urge individuals to go to YouTube and Google Christine Cyborg Santos. She's the female fighter known as Cyborg within the UFC, who just won a title fight a couple weekends ago. There is a short, I believe it's about 45, 50-minute documentary that was produced by her own group that followed her during a weight cut. And it's just terrifying to see the pain and suffering and the danger that she put herself in during the course of this cut. And it's instances like that are happening, really every weekend, every week in athletes that are fighting at high levels. I tip my hat to the California State Athletic Commission because they've really been a leader within this space. And just last year, they instituted some fairly strict changes on how they are going to approach weight cutting. The most important is probably the same day fight day weigh-in. There is a mandatory weigh-in approximately 24 hours before the fight, but then they are doing a second weigh-in on the day of the fight. And if the athlete has gained back more than 10% of his or her body weight after initial weigh-in, the fighter at that point in time is required to increase his weight classification for his next bout. So there are some new guidelines that have a bit more teeth, so to speak, that are emerging, but there's still a long way to go.
Indeed. And what are you seeing on your end with the performance enhancing drugs? Are they, using them throughout? Are they using them right before? They're just not being detected? How are we seeing that in MMA and combat sports?
I know that's a good question. And before I go, if I could go back to weight cutting for a second.
Sure.
From a neurologic standpoint, obviously there are a number of health concerns with weight cutting just from a general health standpoint. But when you really boil it down to neurologic health, there is some limited data in that regard, which shows a number of things. It shows increased ventricular dilation or dilatation with concurrent cerebral atrophy. So the brain actually seems to lose volume somewhat during the course of acute dehydration. Also, and I would say probably more interestingly, during acute dehydration, the body does a number of things to try to offset that, and one of those is plasma vasopressin increases. When plasma vasopressin increases, there is a subsequent decreased blood flow to the choroid plexus, and the choroid plexus is where cerebrospinal fluid is produced. So by increasing plasma vasopressin and decreasing blood flow to the choroid plexus, you have decreased CSF formation. Now, when you take that a step further down the road and realize that cerebrospinal fluid is the body's natural buffer around the brain and what provides us that cushion between the brain and the skull, with decreased CSF formation, you have a limited buffer system that is God-given and there for a reason. And the theory is that with decreased CSF and a decreased buffer, that there is an increased risk of concussion in the right settings, such as a combat sport fight. So that's the concern from a neurologic standpoint.
Wow, that's fascinating. Yeah, I've actually not heard that, so thank you I like to learn one new thing a day, and you just hit that off, hit the nail on the head right there, Tad. That's awesome. And just, I think even in general, if we extrapolate that data and just look at our just normal athletes, if we were trying to, what's the word I'm looking for? Try to resist hydration levels like in old school football practices and two-a-days and things like that. And, not having hydration back in the day was kind of like looked at as like a manly thing on the field. It just, even more reason to keep our athletes hydrated in all sports.
Yeah, that's a great point. And going back to, weight cutting, we as clinicians can talk until we're blue in the face to these athletes about increased risk. And I don't think that message is going to get through. I think the way to approach this is by weight cutting. You are instituting a situation that's going to result in decreased performance within the cage or the ring. Mm-hmm. I think if we frame the argument as one of performance, because there is good, clear data that acute dehydration results in decreased cognitive skills and even decreased motor movements, decreased balance performance measures. So if we frame this from a measure of performance, I think that's where we might start to make some strides in convincing these athletes that there's another and a better way.
Indeed. And, I think we've seen that essentially, right? The data already exists for that of smoking, right? I don't know about you in Kentucky, but here in New York, if you go to like a bodega on the corner, which is like a deli for everybody else in the world, where they have all the things, there's always a cat sitting on the bread. If you're a New Yorker, you understand what that means. But, you can kind of get everything there. But, you'll look, there'll be a pack of cigarettes. They're like almost $20, I think, now. I'm a non-smoker, but you see a lot of folks in the lower socioeconomic areas, buying packs and packs of cigarettes.
No, I'm in Kentucky. I'm in Kentucky. You can find cigarettes anywhere.
Exactly. That's right. You're in the whiskey state. Good Lord. That's right. What am I talking about here, Dad? Goodness. But you've got on, I don't know if you have the packs out by you, but we have like actual like fetal alcohol syndrome and like smoking like pregnancies and fetuses like on our cigarette packs. It's actually horrifying to see if you see them, and they're just trying to scare the bejesus out of people. But essentially, it's obviously not working because they're still buying them,
right?
Like Tic Tacs. But I think we've seen that with the smoking data. You can't scare people into changing a behavior. So I think that's perfect advice to all folks to just talk about this as a performance enhancement. Or decrease in whatever. So that was great to hear. In terms of challenges in the ring, what are you seeing as a ringside doc, right? What are you seeing? Are athletes that maybe don't know you? Do they try to fight you off? Do they just want to, obviously with concussion, everyone's going to essentially say they're fine, right? They're fine. We just want to be adults. And I say that when I'm teaching as grown-ups, not in the pediatric population, but as grown-ups, we want to do two things, and we want to be independent. We don't want to poop our pants or pee our pants, and we want to drive. So if you take away folks' independence, it starts to create, some kind of contextual, rubbing of the wrong way. What are you seeing in terms of, you're obviously the doc, you're in the ringside or next to the cage, and you have to come in and assess the athlete. What are you seeing that are difficult things for you in that arena?
Well, you're always going to get a little bit of pushback from the athlete, but what I try to do is, it's really about education, and it's just as much education of the athlete, but also their cornermen, their trainers, all of their peripheral individuals, and their posse around them, so to speak. Mm-hmm. And here in Kentucky, we've really made a push to educate really anybody that comes into a combat sports gym to train about the dangers of weight cutting, about the dangers of repetitive head trauma that you can be exposed to in this genre of sport, and why it's important to listen to the ringside doc on the day of the fight. Now, does that help? I don't know. I think it does on some level. But I was encouraged just last night. I was watching a fight on television between Lamont Peterson and Errol Spence that happened right there in Brooklyn, actually, last night. And the fight was stopped. It wasn't stopped by the ref. It wasn't stopped by the ringside doc. The fight was stopped by his corner, which I think is impressive. And I think that's a sign that we're getting through to somebody. We're getting through to somebody, because there's a corner man that could have probably allowed his fighter to continue to go back out and fight, but he said enough's enough and was willing to step up and do the right thing with regard to fighter health and safety.
Indeed. And it's no different than when we're seeing athletes that we may not know. That person that essentially knows you best, that has the best rapport, they'll know your quote unquote baseline. So they'll know if you're kind of getting pushed. So really kudos to that cornerman, in Brooklyn last night, because, that's really doing his job, to the fullest extent. I'm just reading, through some of your article here, entitled Neurologic Health in Combat Sports. When was this published, Tad? I'm looking here. This
It
was in
was in
2017.
2017. I believe it was in August or September.
Yep. So summer, fall 2017. A really great article for folks to look out for. Again, it's called Neurologic Health in Combat Sports. Really eye-opening. And it's fascinating to me that MMA, mixed martial arts, actually, is rapidly gaining acceptance, and it's actually more popular than boxing, the NHL, and National Association for the NASCAR for 18 to 34-year-old males. So I
Yeah,
don't see this going away. Everyone is kind of talking about like, oh, these sports are going to go away.
Think about
But
the Mayweather. Yeah, when you think about the pay-per-view numbers here
oh my gosh.
The last couple of years, Mayweather Pacquiao sold 4.6 million pay-per-views.
Wow.
Mayweather McGregor just this last fall 4.4 pay-per-views. So again, there's an audience there, and there's an audience that likely isn't going anywhere anytime soon.
Yeah.
With regard to MMA.
Yeah, and I say that as a healthcare professional. When I got concussed, and I was like, well, we've got to just do better from a healthcare standpoint, and I genuinely mean this, which is why I started Concussion Corner. But we've got to speak to healthcare professionals, because the argument out there, in the press and so on, is that, oh, these sports aren't going to exist in 5, 10, 15, 20 years. But we've got to take care of the men and women that are presently, under the duress of these sports, and these things aren't going away just based off of numbers and financial, fiscal
No,
investment.
absolutely. And just to clarify, before we get a number of emails, I realize that those Mayweather fights, I realize were boxing, but I just say really more so the genre of combat sports isn't going away, and that subsport of mixed martial arts under the umbrella of combat sports, that is a very, very rapidly growing sport. So you're correct. These athletes are going to be there. They're going to be participating in this, whether we like it or not. So I think that we play a role in trying to make that as safe as possible.
Indeed. And, and I think it's great that you spoke about the socioeconomic considerations, and the benefit of exercise, the self-discipline, and the familial structure that a lot of these athletes, are essentially carrying whole families based off of their skill set. So I think that's so important. And essentially, we're really talking about valuing the healthcare advocacy provided by a sports medicine physician or other clinician in the ring or in the clinic. So essentially, we need to make sure we're taking care of these men and women today, and then we'll worry about the fights that come along with this later. But the fact is that these things exist. I think it would be almost like unfair or a poor interviewer of myself to not talk about the potential neurological disorders that kind of come about with chronic traumatic brain injury or repetitive head injuries that we see in these contact sports, Tad. So I was just wondering if you can comment a bit on, just so the listener is at least somewhat educated, they can go seek out some more information. Again, we can have you on here for days. So, if we have you, I'm sure we'll have you on again. But if you could just comment on, the long-term neurological sequelae that we've essentially been seeing with, ranging from post-traumatic headache, chronic post-concussive syndrome, post-traumatic Parkinsonianism, which I think is what we saw with Muhammad Ali. Is that right?
Correct.
Yeah. Post-traumatic dementia pugilistica, and CTE. I was wondering if you can comment on that. And by the way, I'm just giving you kudos. I liked how you talked about in the beginning with your dad that you were watching late Ali, so you didn't age yourself too much there. So that was kudos to you, because I was watching probably the same stuff.
No, you're right. The number one concern in combat sports is the exposure to repetitive head trauma and what that means for these athletes later in life. And indeed, about the studies have estimated about 20 to 50% of former boxers have symptoms of chronic brain injury, and that ranges from Parkinsonism to post-traumatic dementia to dementia pugilistica, to true chronic traumatic encephalopathy. So again, I think the role of us as clinicians is to try to limit that progression. 50% is too high. Even 20% is too high. But there is going to be, there are going to be some athletes that have chronic traumatic brain injury from the sport just because of the nature of the sport. But I think that we can make it safer, and I think that we can monitor these guys guys and girls a bit better, and perhaps indicate to them when it's time to hang up the gloves and when it's time to take that final step out of the ring or the cage to try to mitigate those long-term health issues.
Indeed. And, as we come up to the 30-minute mark here, I just want to make it really clear for our listeners. If you have a concussed individual, patient, athlete, whomever is in front of you, we actually, and this is really work stemming from Kevin Guskowitz et al., out of University of North Carolina, and many others, quite frankly, looking at threshold of force. We actually don't know G forces, or forces that essentially cause concussion. There's no number. And there's also no number, which I think we spoke about with Dr. Jeff Kutcher in our first couple episodes of Concussion Corner. There's also no number. This number of 3, just needs to be put to the wayside. We essentially know that 1 is too many, but we don't essentially change someone's life trajectory based off of number, which is why this injury is so important that it's a clinical diagnosis only, present day. You have to have someone who's skilled in looking at this, that's been exposed to the injury, that's actively involved in the research, and facilitating these cross-disciplinary conversations. Because I don't know about you, Tad, but I see folks in high school and even college, and even I've seen some middle schoolers where like, oh, pediatrician or primary care doc or whomever it is, because again, we're all in this fight together, says, oh, you've had 3 concussions, you've got to call it a day. And then these kids become like obese, depressed individuals because you basically took away part of their identity and their ability to move and be active. I don't know, are you seeing that in Kentucky as well?
Oh yeah. I always hear the magic number of 3 somehow. I don't know how that urban legend got started, but it's alive and well. So I deal with that here almost on a weekly basis, and just like you and just like Jeff, try to educate that it's not really about the number. It's about the recovery that took place after said injury.
Indeed. And, and how long they recovered. And again, we can probably have a whole episode just on that. So that might be planting the seed for y'all. I'll water that later, potentially at another conference or something like that for you. But again, we'll come back to this concept. And actually, with Jeff on Dr. Kutcher's episodes, we actually spoke about the urban legend of 3 concussions, right? So I'll actually send that over to you, and our listeners already have that article and reference, because he educated me there. That was my 1 a day new topic, new learning piece. So Tad, what's the best way for folks to reach out to you? I know you're super active on Twitter. I know you're heading out the Norton Healthcare clinic as well. What's the best way for folks to reach out to you?
Yeah, on Twitter I'm at NeuroDocTad. That's at Neuro Neuro Doc DOC Tad TAD. My clinic telephone number is 502-899-6782. And I'm also happy to communicate via email. My email is Tad, that's TAD.Seifert, SEIFERT, at Norton with an N, that's Norton as in N as in Nancy, nortonhealthcare.org.
Awesome. Well, I know our listeners are definitely going to benefit from this conversation, because these athletes are out there all over. So again, I hope this message comes across clear, and thank you so much for your time and your expertise today. Great.
Thanks so much, Jessica. I enjoyed it, as always.
All right. I'll talk to you soon.
Okay.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.